Hello everyone. Today I will be doing the Student Poverty in Richland 1 presentation, a community call to action. Good morning, council members. My name is Leanna Crawford and I'm here to talk to you about a critical issue affecting our community. Student poverty in the Richland 1 school zone, specifically here in Hopkins. I will be focusing on my kids' school, to be exact, Horror Hill Elementary. While the challenges may seem distant to some, their impact ripples through all of our lives, and addressing them is vital for the health and the future of our entire community. Understanding the disparity. So what exactly is this disparity? We're talking about the significant number of students in our Richland 1 schools, particularly in the Hopkins area, who live below the poverty line. This isn't just about finances, it's about the daily struggles that come with it. Food insecurity, unstable housing, limited access to healthcare, and the lack of educational resources. So here in this graph, you see the student poverty rate for Richland 1, which is 72%, versus the student poverty rate for Lexington 1, which is only 33%. This is a huge gap between Richland 1 school systems and Lexington 1 school systems. This lets us know that we have a lot of work to do in order to make sure that these students in Richland 1 have a better quality of life in the school system. So who is this affecting the most? It impacts our most vulnerable families, often those from historically marginalized communities. These are our neighbors, friends, and the children who will one day run and lead our community. The issue is that those students often start at a disadvantage, and without intervention, the gap only widens. The impact on the community. Student poverty leads to lower academic achievement, higher dropout rates, long-term economic instability for individuals in Hopkins as a whole, strains on social services, limits future workforce potential, and diminishes the vibrancy of the community. Richland 1 and Richland District 2 have a lower dropout rate at a 1% versus Richland 1 with a 3.5%. This suggests that better student retention is accounted for in District 2. This is a concern because every child deserves equal opportunities to succeed, and when we fail them, we fail ourselves. And as you can see to the right, here's our chart with Richland 1 at 3.5% dropout rate and Richland 2 at a 1.1 dropout rate. Where is this disparity occurring? It's right here in the neighborhood surrounding our Richland 1 schools in Hopkins. But thankfully, resources are also right here. We have dedicated community centers, food banks, local churches, and passionate nonprofits already working to address these needs. The challenge is connecting these resources effectively and expanding their reach in the community. A path forward: communication, intervention, and policy. Currently, communication about these issues can be fragmented. While many organizations are doing a good work, there isn't always a cohesive strategy to reach every family in need or to fully inform the broader community and the policymakers. To improve equity for all, we need a more unified approach. For the public health problem solving methodology, we're going to propose a public health problem-solving methodology that starts with a comprehensive community need assessment, engaging directly with the affected families. This will allow us to identify specific gaps and tailor interventions. We then will move to develop targeted interventions and policy alternatives. For example, I might advocate for increased funding for school-based health clinics and expand the after-school programs that offer tutoring and meals, and support initiatives that provide stable housing for families. So here's to the right, you'll see my vision of a free after-school program for kids that will have tutors there and free food, also healthy food, so they can have a healthy choice for their food. So the strategies that we will take to reduce this disparity: number one is communication. Communication is the number one bridge between the need and solution. By clearly and consistently communicating the realities of student poverty, the available resources, and the impact of policy, we can educate, we can connect the families to resources, and we can advocate for policy change. We can educate so we can inform the public, we connect the families so we can ensure that those need that need to know where to find help will be able to find help. And we can advocate for the policy change by providing data and stories that needed to drive legislative action. Here are my resources. Thank you for listening, and I hope you will take this initiative and this program into consideration for the future of Richland 1 school systems. Thank you. Have a good day.